What you should see by now, if you compare your previous modules to today's module, is that there are characteristics within a language or a dialect that may be perceived as disordered productions. So as speech pathologists, we have to differentiate between what is a dialect and what is a disorder, and it can be challenging as we are unfamiliar with different dialects, as we are accustoming ourselves to learning new languages, and as we are providing services to individuals with more and more cultural diversity. So, looking at this, we have different productions and targets of what standard dialect may look like versus how it could be confused with a disorder. So our buddy Sam's going to go through a lot of things today. And the first one is Sam is walking. And the production could be Sam be walking. So we see that be is used instead of is. And we talk about this with semantics and morphology and using the different morphemes to change the meaning of the sentence. And then we have Sam drinks milk every day. And the production could be he drink milk. And it's the same thing where we're losing that morpheme and we're losing the specificity of that instance in storytelling. And then we have the target, yesterday Sam went fishing, and we have Sam fish yesterday. So this should illustrate to you that this can kind of convolute and confuse the speech therapist who's doing the assessment as they're looking at these productions, and can you determine, is this a dialect, is this a disorder, and how do I know the difference between the two? So previously there was this idea of if it is a dialect, it is not a disorder. So there was this saying, and I learned it when I was in undergraduate, a dialect is not a disorder. But that makes the two mutually exclusive and indicates that if someone has a dialect or a second language, they cannot have a disorder, and it's simply not true. So they've moved now into the two-box theory, which indicates that we have a box with a dialect and we have a box with a disorder. And we have to identify the structures and the productions that are not age-appropriate or standard within that dialect, exclude all of those structures that can be explained by the child's dialectal community, and consider anything that's not within that normal set to be a language disorder or speech disorder. And then we base that diagnosis on the errors identified in differentiating between the two productions and associations. That way we make a diagnosis based on the true errors and eliminate any possibility of the dialect influencing that. And you might say, well, how do I do that if we have, 10 different areas of dialects, and, we have just in Louisiana the Cajun, the Creole, the Standard American English, and how do I know the difference? And ultimately it comes down to educating yourself. Getting out there and learning about these different communities, especially if you are in the population or serving populations that are more likely to have these types of dialects or accented productions. What can become challenging is understanding where our lines have to be drawn to say, we have educational requirements that we learn a second language, and sometimes there is the assumption that as you learn a second language, you are proficient in that language and you can learn it and treat patients with that language as well. And what ASHA has come to grow and accept, and it's an ongoing process, is that that's simply not true. We have to be proficient in languages to be able to provide services, and if we are not, then we have to call in help. And that can be finding a speech pathologist in the area who is proficient in that language, using the assistance of an interpreter who is trained with speech pathology, or finding additional resources to those patients, because ultimately we cannot disclude somebody because they have an accent or a dialect and not allow them to receive services because of that. We have to find a way to help them. But it does become challenging, and you have to keep in mind that this is an ongoing and growing area of focus within our national organization, and it's kind of falling down to the individual speech therapist to determine how they treat and assess individuals with a dialect and a disorder. So by the time, if you are going into speech pathology or audiology, that you graduate from graduate school, your rules for cultural competence may be very different from what you're learning in this class today, because even for me, they have changed from the 5 or 7 years ago when I learned about dialect not being a disorder. What I have attached for you on the module page is the overarching rules for treating individuals with bilingualism. As a speech pathologist and an audiologist, I recommend that you go through those, even if you aren't quite to the point of deciding if you're going to be a speech pathologist or audiologist. If you are looking at your course requirements and moving into the future, the way that you advocate yourself as a bilingual speaker can change based on reading that document from ASHA. To say it's not enough to just take the classes, you really do have to have that interaction and that ability to use those different levels of the language domains.